name's Adam Rudinsky, and I'm an associate professor at The Ohio State University College of Veterinary Medicine in Columbus, Ohio in the United States. I love to be here with Royal Canin for the Ask the Experts session. Worms is kind of something that we throw around, and everyone kind of understands that it's a common term for parasites, and specifically gastrointestinal parasites is one of the most common that we're dealing with. So this can range from classic parasites like hookworms, roundworms, and whipworms, which you may have heard of when seeing your veterinarian or talking to other people with pets because of the frequency that we see those parasites. And there's also a whole other range of parasites like Giardia that can affect the animals as well. The animals that are most at risk for gastrointestinal parasitic infections are our young cats and dogs. So when you're in for your initial health checks, one of the biggest things to do is talk to your veterinarian and work with them to screen for those parasites and treat them if they're there. The reason for that is the range of clinical signs that we see in animals that have parasitic infections goes all the way from completely normal, my animal looks happy and healthy with no outward evidence of disease, to animals that have really severe and even life-threatening clinical signs. With parasite infections, we can actually have really, really bad consequences for healthy development of your pet's gastrointestinal tract. So regardless of whether your puppy or kitten has no clinical signs or is already affected, the best policy is always to be proactive, talk to your veterinarian, and screen for parasites because we want to prevent a bigger problem before it happens. A good rule of thumb is when you have a puppy or kitten, because the prevalence of parasites in that group is so high, always screen for them or test for them when you're in talking to your veterinarian because the prevalence is there and we want to be cognizant of that and manage it quickly. Now, you need to work with your veterinarian in this process because there are some parasites that are pathogenic or problematic, and there are some that actually don't cause quite as many problems, and that can even vary within the individual animal. So your veterinarian's the best suited contact for you to try to figure that out. But importantly, there's many, many complications that can occur if we leave those gastrointestinal infections, or parasitic infections specifically, unchecked. Namely, because it happens so frequently in kittens and puppies, we actually risk altering that maturation of their gastrointestinal tract and allowing them to grow up happy and healthy if we don't address those problems early in life.